On behalf of the Agency for Healthcare Administration, welcome to this training on compliance tips for Florida Medicaid providers. The Florida Medicaid program is offering this training as an opportunity to increase your understanding of program compliance, as well as your understanding of the value of keeping informed on Medicaid policy. This is an overview of compliance-related issues and will assist new providers with basic Medicaid compliance tips, and will also serve as a refresher for existing providers. We also want to assist all providers in your efforts to improve compliance. The objectives of this training are to share basic Florida Medicaid compliance tips that might seem obvious, but are common areas of non-compliance that we would like to make sure our new Florida Medicaid providers are aware of and are actively taking steps to avoid. We also want to refresh current Florida Medicaid providers on basic Medicaid compliance information and remind you to also take steps to ensure you are following the program rules. It is our goal to assist all providers in improving compliance with Florida Medicaid policy. Throughout this training, we may refer to the Agency for Healthcare Administration as simply the agency or AHCA. This presentation is divided into 6 sections. Section 1 addresses the Florida Medicaid Provider Handbooks. Section 2 will cover licensure and certification issues for Medicaid providers. Section 3 will highlight required changes to provider enrollment files. In Section 4, we will provide information about records inspection, and in Section 5, we will share information about additional resources for Florida Medicaid providers. And finally, the 6th section will conclude the training presentation with a summary. Let's begin by talking about the Florida Medicaid Handbooks. Medicaid providers should consider the 3 types of Florida Medicaid handbooks that exist. These handbooks contain many of the requirements for providers to remain compliant with the program's policies. The handbooks are essential for a provider to ensure that they know where to find the policies that govern their practice and their billing. First is the Provider General Handbook, which is relevant to all providers. Second are the Coverage and Limitations Handbook, which are specific to particular provider types and services. This means that there are several Coverage and Limitations Handbooks. A provider should be familiar with the Coverage and Limitations Handbook or books that relate to the types of goods or services that they furnish. And finally, there are Reimbursement Handbooks, which are also relative to the provider type, but specific to whether you are an institutional provider or a non-institutional provider. These handbooks address how to get paid. Providers should become familiar with each of these handbooks. The Medicaid handbooks are critical for you as a provider. They document the policies and procedures needed to receive reimbursement and ensure that goods or services are furnished in accordance with policy. While the handbooks are not the only laws that providers are required to comply with, they are the provisions that are most often the subject of agency-initiated audits. The handbooks provide detailed descriptions and instructions about how and when to complete forms, letters, and other documentation necessary for full compliance and appropriate reimbursement from the Medicaid program. The Florida Medicaid Provider General Handbook contains general information for providers. It provides an explanation of the Florida Medicaid program and policies and is an essential foundation for all new providers. It provides information that will help providers ensure that they are only billing for services for eligible recipients and that they are knowledgeable about provider enrollment issues, which are critical to ensuring their continued participation in the program. The Provider General Handbook also contains provider eligibility requirements that must be maintained to ensure continued eligibility to participate in the program. It has a chapter on crossover payments and has a chapter about Medicaid fraud and abuse that highlights the agency's program integrity efforts. The Coverage and Limitations Handbook explains covered services and policies for each type of Medicaid service. The handbooks explain the details about what the Medicaid program will pay for. They also explain the policy limitations, exclusions, and procedure codes. The handbooks also provide descriptions and instructions on how to and when to complete forms that are required for particular services, and provide details about the program's required documentation for particular services. A provider who furnishes more than one type of service will have more than one Coverage and Limitations Handbook. The Reimbursement Handbooks provide necessary guidance for billing the Medicaid program. Each reimbursement handbook is named for the corresponding claim form and explains how to complete and file claims for reimbursement from Medicaid. They also contain generic eligibility information general Medicaid information, and claim instructions. As we've explained previously, it is critical that the Florida Medicaid providers follow Medicaid policy in all three types of handbooks. Providers who understand the relationship between the Florida Medicaid Provider General Handbook, the Service-Specific Coverage and Limitations Handbook that governs their practice, and the Florida Medicaid Provider Reimbursement Handbook can increase the effectiveness of their internal compliance efforts. All Florida Medicaid handbooks, fee schedules, forms, provider notices, and other important Medicaid information are available on the Medicaid Fiscal Agent's web portal at http://mymedicaid-florida.com/. The Florida Medicaid's web portal solution provides communication, data exchange, and self-service tools to the provider community. The web portal consists of both public and secure areas. Those web pages will require a username and password for access for your security. The public area contains general information such as program awareness, notices, and forms. For Section 2 of the presentation, let's continue our discussion and talk about licensure and certification. Each Medicaid applicant, in-state and those who are out of state, must sign a Medicaid provider agreement that affirms compliance with all laws and rules governing the delivery and reimbursement of services or goods to Medicaid recipients. The applicant is also responsible for its employees and contractees maintaining compliance with the terms of the agreement. Please also remember that the Medicaid provider shall possess at the time of signing of the Medicaid provider agreement and maintain in good standing throughout the period of the agreement's effectiveness a valid professional, occupational, now commonly known as the business tax receipt, facility, or other license pertinent to the services or goods being provided as required by the state or locality in which the provider is located, and the federal government, if applicable. The business tax receipt is proof of payment of the business tax. It is required before a business opens or starts. A business operating without a business tax receipt is subject to a penalty. Healthcare practitioners must be actively licensed to practice as required in the applicable Coverage and Limitations Handbook, to enroll as Medicaid providers and to remain enrolled. Please be aware that Medicaid will terminate providers who fail to maintain professional licensure effective the date that the license was terminated. If a provider continues to receive payment for services rendered after his license has expired, the payments will be subject to recoupment. The provider may also be subject to sanctions and referred for further review to other agencies, including the Attorney General's Medicaid Fraud Control Unit, for such issues as unlicensed practices or suspected fraud for billing for services that require a license which were rendered by unlicensed personnel. The agency's Division of Health Quality Assurance, sometimes referred to simply as HQA, protects Floridians through oversight of healthcare providers. HQA licenses and or certifies and regulates 40 different types of healthcare providers, including hospitals, nursing homes, assisted living facilities, and home health agencies. In total, the division licenses, certifies, regulates, or provides exemptions for more than 42,000 providers. The Medicaid Fiscal Agent periodically compares the provider license file to the Department of Health's healthcare practitioner license files and to the HQA facility license files. The Department of Health is commonly referred to as DOH. If a Medicaid provider's licensure information is missing from the provider enrollment file or does not match an active number on the DOH or HQA licensure file, the provider may be disenrolled from the Medicaid program. The failure to maintain required licenses can also result in sanctions from the Medicaid program. The following providers must be Medicare certified in order to enroll as Medicaid providers and to remain enrolled: ambulatory surgical centers, freestanding dialysis centers, hospices, hospitals, rural health clinics, portable X-ray providers. Home health agencies and skilled nursing facilities must be either Medicare certified or meet the standards for certification. While ACA does not operate the Medicare program, the staff in HQA conduct the Medicare surveys to determine if the facility is in compliance with the Medicare certification standards. Medicaid regularly receives certification information from HQA. Medicaid will terminate providers who fail to maintain standards of certification effective the date of the Medicare termination. If a Florida Medicaid provider continues to receive payment for services rendered after it is no longer in compliance with the Medicare certification standards, the payments are subject to recoupment. The provider may also be subject to sanction and referred for further review to other agencies, including the Attorney General's Medicaid Fraud Control Unit. An excellent resource for providers is the agency's website, which is located at http://ahca.myflorida.com/mchq/index.shtml on the HQA homepage. ACCA's division of HQA consists of 5 bureaus: the Bureau of Field Operations, the Bureau of Health Facility Regulation, the Bureau of Long-Term Care Services, the Bureau of Managed Health Care, and the Bureau of Plans and Construction. The Bureau of Field Operation is responsible for completing on-site surveys to determine compliance with state licensure requirements and compliance with federal certification requirements for certified facilities, and for handling consumer complaints. The Bureau of Health Facility Regulations handles healthcare licensure, Medicare and Medicaid certification, and regulation for hospitals, ambulatory surgical centers, home health agencies, hospices, clinical laboratories, and over 20 other types of healthcare providers. The Bureau also contains the Certificate of Need, which you will often hear referred to as CON, Hospital Financial Analysis Programs, Hospital Ambulatory Surgical Center Risk Management Program, and the Organ Donor Education Registry Program. Another good resource for licensure and certification resources is the Department of Health's Division of Medical Quality Assurance, MQA, which offers many services to their licensees and healthcare businesses. Their website is http://www.doh.state.fl.us/MQA services/. Working in conjunction with 22 boards and 6 councils, MQA licenses and regulates 7 types of facilities and 200-plus license types in more than 40 healthcare professions. Now, let's move on to Section 3, where we'll talk about changes to the provider enrollment file. Providers are required to promptly notify Medicaid of any changes of address. Having an accurate address on file with the agency ensures accurate communication, including prompt payment for services rendered. The following 4 addresses may be housed on the provider file: the service address, a pay-to address, a mail-to or correspondence address, and a home or corporate office address. To report a change of address, providers must obtain and complete the Medicaid Provider Change of Address Request, ACCA Form 2200-0004, dated July 2008. The form is available by calling the Provider Contact Center at 1-800-289-7799 and selecting Option 4. The form is also available from the Medicaid Fiscal Agent's web portal at http://mymedicaid-florida.com. Select Secure Information for Providers, then Demographic Maintenance, and then Location Name Address. If first-class mail to a provider's service address is returned, Medicaid will suspend claims payments to the provider or the provider's group for services rendered by that provider. After 90 days, the suspended claims will be denied if the provider has not taken the corrective action to update their address. This action by the agency has an impact on the provider's payments, so please be very diligent in reporting changes of address. Another common error that has adverse consequences for providers is when a group moves and updates the group's address, but forgets to update the addresses for each of the individuals who participate in that group. Should the agency need to communicate with an individual member of the group and the address hasn't been updated, the individual member could be terminated due to the bad address. This would have adverse implications for both the individual provider as well as the group provider. Individual or group providers who render services at more than one service address under a single license or certification are required to submit a new location request form to identify each separate physical address where services are provided. Also, please remember, in order to report a change of address, the provider must obtain and complete the Medicaid Provider Change of Address Request form. The form is available from the Medicaid Fiscal Agent's web portal at http://mymedicaid-florida.com. Select Secure Information for Providers, then Demographic Maintenance and Location Name Address. You may also call the Provider Contact Center at 1-800-289-7799 and select option 4 to request the form. For those individual or group providers who provide only one type of service but are uniquely licensed or certified for each location, you are required to submit a separate Florida Medicaid Provider Enrollment application to obtain a unique Medicaid identification suffix for each location. You'll also want to be aware that any closure of a provider's practice address must also be reported to the fiscal agent along with the effective date of the closure. This is a reminder that in Section P of the Medicaid Provider Agreement, providers agree to notify the agency of any changes to the information furnished on the Florida Medicaid Provider Enrollment application, including changes of address, tax identification number, group affiliation, depository bank account, and principals. Failure to promptly notify Medicaid about office closures can adversely impact a provider with regard to any subsequent provider enrollment applications. Florida statutes define a change of ownership as an event in which the provider changes to a different legal entity or in which 51% or more of the ownership, voting shares, or controlling interest in a corporation whose shares are not publicly traded on a recognized stock exchange is transferred or assigned, including the final transfer or assignment of multiple transfers or assignments over a 2-year period that cumulatively total 51% or more. A change solely in the management company or board of directors is not a change of ownership. Per Section 409.907, Parent 6 of the Florida statutes, at least 60 days before the anticipated date of a change of ownership, the transferor is required to notify ACA of the intended change of ownership, and the transferee is required to submit a Medicaid provider enrollment application. If a change of ownership occurs without compliance according to the notice requirements, both the transferor and the transferee are liable for overpayments, administrative fines, and other monies due to ACA. Changes of ownership are oftentimes referred to by the acronym CHOW or CHOW. Before a CHOW application may be granted, ACA may require the transferee or transferor to repay all outstanding overpayments, administrative fines, and other monies due to ACA. ACA may also seek any other legal or equitable remedies available to recover monies owed to the Medicaid program. Again, this means that both the transferor and the transferee have obligations to ensure compliance, and both parties may be liable if compliance is not achieved. Bear in mind that when you signed the Medicaid agreement, you agreed to notify the agency of any changes to the information furnished on the Florida Medicaid Provider Enrollment application, including changes regarding your tax identification number. If a provider's tax identification number changes, the Medicaid Provider ID must be terminated, and a new Medicaid Provider ID must be established for the new entity. If the change to the tax ID is due to a change in ownership, then the procedures for a change in ownership must be followed. The fiscal agent may change a tax identification number only under the following circumstances. The provider submits a copy of the IRS form letter indicating the provider's new tax identification number, or the provider acquires an existing company and requests that its tax identification number be changed to the existing provider's own tax identification number. Let's talk a bit about federal tax identification numbers, or FIN numbers as they are also known, and how they affect provider IDs. There are some instances where the provider's ownership changes and the tax identification number will remain the same. Keep in mind, though, that whenever the ownership does change, the Medicaid Provider ID must be terminated and a new Medicaid Provider ID must be established. It is very important that you report any changes in telephone numbers to the Medicaid fiscal agent. Except for a change of address, information about a provider can only be changed by the provider submitting a written, signed, and dated request on letterhead stationery. The request must be signed by an authorized person on the provider file. The Medicaid Provider ID must be included. Notice of a change in telephone number or numbers must include the new telephone number or numbers and the provider's previous telephone number or numbers. Providers who participate in Medicare are required to notify the agency within 5 business days after suspension or disenrollment from Medicare. Failure to notify ACA may result in sanctions being imposed, and the provider may be required to return funds paid during the period of time that the provider was suspended or disenrolled as a Medicare provider. Medicaid will immediately terminate providers who are suspended, excluded, or terminated from Medicare or any other state's Medicaid program. The effective date of the termination will be the date that the provider was suspended, excluded, or terminated from the Medicaid or Medicare program. At this point in our presentation, we'll discuss a few final areas of significance regarding provider enrollment files. When an individual member joins or leaves the group, either the group provider or the individual member must report the change. To add an individual to a group, send a letter to the fiscal agent. The letter must include the group's provider identification number, the individual's provider identification number, and the date the individual joined the group. This letter must be signed by the individual provider. To remove an individual from a group's membership, you'll also need to send a letter to the fiscal agent. The letter must include the group's provider identification number, the individual's provider identification number, and the date the individual left the group. The letter to remove an individual from a group may be signed by either the group or the individual provider. The individual needs to submit a change of address form when they leave a group. If the group's address remains on the individual's provider file, the mail will continue to go to the old group's address. As we previously explained, this can have adverse consequences for the provider. Let's talk about electronic funds transfers, automatic deposits, and payments to provide some clarification. Information on the automatic deposits and payments, or EFT record, can only be changed by authorized individuals. A new EFT form must be completed and submitted to the fiscal agent by individuals who are listed on the current provider file as having authorization to sign on the provider's bank account. The new EFT form must contain an original signature or signatures, the provider ID, and must be accompanied by a letter from the depository branch verifying the name on the account number, and the routing or transmittal number. A significant resource for Medicaid providers is the Florida Medicaid Fiscal Agent. The fiscal agent enrolls non-institutional providers, processes claims, and distributes Medicaid forms and publications. General provider and recipient information can be found on the Florida Medicaid's web portal. For provider-specific information, visit the provider web portal, and for recipient-specific information, visit the recipient web portal. The Medicaid Fiscal Agent web portal provides communication, data exchange, and self-service tools to the provider community. The portal consists of both public and secure areas, web pages requiring a username and password. The public area contains general information, such as program awareness, notices, and forms, and allows users to respond to surveys. In the portal's secure area, providers can access their personal information using their provider numbers and PINs, personal identification numbers. Providers can update information on the provider number, update address information, request eligibility verifications, request and track prior authorizations and referrals, submit and track claims, receive alerts and notices, and receive Medicaid policy updates. For important resource information, please visit the Medicaid web portal located at mymedicaid-florida.com. Located here, under the Public Information for Providers link, you can find the Contact Us link that provides important contact information. The Automated Voice Response System number, or AVRS, is 1-800-239-7560. The Provider Services main number is 1-800-289-7799. The Electronic Data Interchange, or EDI number, is 1-866-586-0961. And the Magellan Medicaid Administration for Pharmacy Services number is 1-800-603-1714. Make note of these important resource numbers. Now, let's continue to Section 4, where we'll talk about the inspection of records. From time to time, Medicaid providers may be monitored, audited, or reviewed by authorized state and/or federal agencies and their authorized representatives. The review may include provider or facility records that could include employee files, as well as recipient charts and a site visit of the physical location of the business. These visits can be announced or unannounced. The Provider General Handbook and your Medicaid Provider Agreement state that the reviewer may look at all records that the agency finds necessary to determine whether Medicaid payment amounts were or are due. The right to review records requirement applies to the provider's records and records for which the provider is the custodian. The provider must give authorized state and federal agencies and their authorized representatives access to all Medicaid patient records and to other information that cannot be separated from Medicaid-related records. It is a sanctionable offense to delay or deny records from any authorized state or federal agency or from their representatives. This is a reminder that if you are asked to furnish records, the provider must send, at their expense, legible copies of all Medicaid-related information to the authorized state and federal agencies and their authorized representative upon the request of ACA. At the time of the request, all records must be provided, regardless of the media format on which the original records are retained by the provider. Failure to make records available or to refuse access is a sanctionable offense. For the first offense, a $2,500 fine per record or instance of refused access and suspension until the records are made available or access is granted can be assessed to you as a provider. When a provider is in violation of a Medicaid policy, each day that an ongoing violation continues, such as refusing to furnish Medicaid-related records or refusing access to records, is considered to be a separate violation. ACA may seek several remedies for violations of Medicaid policy. There are some easily avoided yet common violations that providers can avoid, and they include a provider who has failed to make available or refused access to Medicaid-related records to an auditor, investigator, or other authorized employee or agent of ACA, the Attorney General, a state attorney, or the federal government, or a provider who has not furnished or has failed to make available such Medicaid-related records as ACA has found necessary to determine whether Medicaid payments are or were due and the amounts thereof. Keeping your Medicaid records in order and readily available is an important provider responsibility. Florida Statute Section 409.913, as well as the Florida Administrative Code, Rule 59G-9.070, identify the sanctions that ACA may impose for violations of Medicaid policy. Some of the sanctions include suspension from participation in the Medicaid program for up to 1 year, termination from participation in the Medicaid program for 20 years, or imposition of fines. Another helpful resource that the Florida Medicaid program has developed is the video named Medicaid Provider Compliance Program and Provider Self-Audits. Please see the video at ahca.myflorida.com/Medicaid/E-library. The video provides a basic overview of federal and state requirements for healthcare providers to ensure program compliance. It also provides general guidance for Florida Medicaid providers about common areas of noncompliance and how to avoid them. Additionally, the video focuses on how a provider can increase compliance and conduct self-audits. Now, let's continue on to Section 5, where we'll talk about additional Medicaid resources. A great resource for providers is your Area Medicaid Program Office. The agency has 13 Medicaid area offices in 11 areas throughout the state. The area offices serve as the local liaisons to providers and recipients. The area offices help with provider relations and training, consumer relations, conducting site visits to providers and potential providers, and handling exceptional claims processing. You can find your Area Medicaid Program Office by visiting the agency's website at mymedicaid-florida.com. There you will also find information, publications, provider training, calendars, and beneficiaries links. Another great resource is the Florida Medicaid Provider Training e-library, located on the web at ahca.myflorida.com/Medicaid/E-library. The library contains training resources for Medicaid providers on Medicaid policy. In the library, you will find PowerPoint presentations and videos about policy and compliance. The site allows you to choose a time that is convenient for you to review the training materials and allow you to learn at your own pace with self-paced learning materials. You can build your knowledge of Medicaid policy, decreasing the risk of noncompliance and avoiding billing errors. Did you know that the Florida Medicaid program has an email alert system? The email alert system is used to supplement the present method of receiving provider alerts information and to notify registered providers or interested parties of late-breaking healthcare information. An email will be delivered to your mailbox when Medicaid policy clarifications or other healthcare information is available that is appropriate for your selected provider type. To subscribe to the automated alert system, complete the online form at ahca.myflorida.com/Medicaid. In the quick links on the right, there is a link to sign up for healthcare alerts. Once you are registered, a confirmation email will be sent to your mailbox to avoid fraudulent subscription requests. Subscribers must return the confirmation email to complete their subscription. In summary, we would like to stress to providers the importance of following the compliance tips presented during this presentation. Make sure to thoroughly review your Medicaid provider agreement. Also, refer to Medicaid policy as it is stated in the Florida Provider General Handbook, Service-Specific Coverage and Limitations Handbook, and the Florida Medicaid Provider Reimbursement Handbook. Use our website to look for updated policy manuals. Make sure you update and properly display required licenses for the goods or services you are providing. Also, make sure to utilize the resources we've discussed, the area offices, the online e-library training videos, the email healthcare alerts, and the agency Medicaid websites. Also, keep in mind that if there is a change of ownership, ACA must be notified prior to the change. The requirements for notification are described in the Florida Medicaid Provider General Handbook. Records that relate to the sale or transfer of the business interest need to be maintained and readily available for inspection. Changes to your address or telephone numbers for individual providers and group providers need to be reported to the Medicaid fiscal agent as soon as they occur. You can obtain the proper form from the website mymedicaid-florida.com. As providers, it is your role to ensure that member affiliations within a group practice are current and accurate. Providers are also required to notify the Medicaid fiscal agent, currently HP Enterprise Services, when associated practitioners leave the group. Both record-keeping and services need to be rendered in accordance with Medicaid policy. Familiarize yourself with the Medicaid Provider Handbook applicable for your practice, and keep in mind that the policy may be different between Medicare and Medicaid. Providers also must ensure that member affiliations within a group practice are current and accurate and are required to notify the Medicaid fiscal agent when associated practitioners leave the group. Both record-keeping and services provided need to be rendered in accordance with Medicaid policy. In conclusion of this training, always remember that it is all of our responsibility to report suspected fraud, abuse, or overpayments to the Florida Medicaid program. Report any suspected Medicaid fraud to the Medicaid Program Integrity Unit. You can learn more about reporting fraud by watching the online video, Report Medicaid Fraud. Thank you for joining us for this training on compliance tips for providers.